for your exam next week, there are 10, 20, 33 questions on reproduction because you didn't have a reproduction final, right? We just went right from the reproduction quiz to the final exam, which covers the whole term 3. So there are a lot of questions on reproduction. So we want to make sure that you know that. There's 12 questions on neuro. There are 5 HIV, 10 sensory,
Okay.
8 oncology, 17 endocrine. There's several on immunology and several on surgery. All right. So let's go to our study guide for the final.
Ms. Robin, I'm at work, so I can't answer a lot of questions.
Okay, that's fine. Yeah, that's okay. What happened to my, oh, here we go. All right, so. We go term 3 final. All right. What you need to watch for following parathyroidectomy or thyroidectomy. When we're doing a thyroidectomy and we accidentally remove the parathyroid, what are we worried about? What are we worried about following a parathyroid or a thyroidectomy? Thyroid storm?
Tetany.
Tetany?
Check the back of the neck and airway patency.
Bleeding, airway, right. So you're going to make sure that when you do have a patient who had a thyroidectomy, we're worried about tetany. We're worried about, because we may have removed the parathyroids. We're worried about thyroid storm. We're worried about bleeding, because remember how bloody how vascular the thyroid is. So you check the back of the neck, all that stuff, right? If you had a thyroid storm, tell me a couple signs and symptoms patient might have. Would they have high pressure or low pressure?
High.
High. How about a fever? Up or down?
Up.
Up, right. So you'd have high fever, high. It's like thyroid. So what happens is the thyroid, when we manipulate the thyroid, it surges out a bunch of thyroid hormones. So it's like you have hyperthyroidism. So all the signs and symptoms of hyperthyroidism, you're getting them. Make sense?
Yes.
All right. What's anaphylactic shock and what are some signs and symptoms of anaphylactic shock? The key term is shock. What happens when you go into shock? What happens to your blood pressure?
It goes up.
It goes down.
It goes down.
It goes down. It goes way down, right? You bottom out and your pulse does what?
Up.
Up, right. So you're going to have, so a patient's going to get restless. They're going to have air hunger. They're going to start to feel like doom, like they're going to die. Their BP is dropping. Their pulse is raising. Okay. All right. If a patient were to have an allergic reaction, what medication would you give them right away?
Epinephrine.
Epinephrine. If the patient's immunodeficient, what are we scared about? We scared about bleeding. We scared
infection.
Infection, right? They're immunocompromised. Their immune system's not working. What angle do you inject insulin?
Sub-Q 2 inches from the umbilicus.
The iliac.
Yeah. So sub-Q, 2 inches away from the umbilicus, all around the abdomen. We rotate sites. We might give 4 or 5 in one arm, then 4 or 5 in another arm. Then we're going to go to the leg. We're going to use all those sites up before we go back. Why is that?
Bruising, and you don't want them getting knots.
Knots. What are those knots called? What are those knots called? Remember what those things were called?
Not hematomas.
No.
I forgot the name of them.
Nitrophy?
Is it lipohypertrophy? Remember this? Can you see my pictures?
Yes.
Yeah. Remember the lipohypertrophy? So that's why we change sites, right? We give injections in the arm, then we give 4 or 5 here, or 3 here. Then we go to the other arm, then we go to the thigh, then we go to the other thigh, we go to the abdomen, we go to the flank area. So we rotate to avoid lipohypertrophy. What angle do you inject that insulin?
Was it 90 degrees or 45?
don't you go straight in?
90.
90
No.
degree angle.
No,
Yeah,
it's
right.
40. Sub-Q is 45, but then when we do it in the stomach, we go in 90.
Yeah, 90 degrees for insulin. You just kind of shoot it right in, 90 degrees. Who can tell me some signs and symptoms of hypoglycemia?
Cold, clammy, irritable, shaky, can't focus, hunger, tremors, headache, heart
Yes.
palpitations, tachycardia, double vision.
Yeah.
You know what, Erica? Are you a doctor?
She studied well. She did her study guide well. So signs and
Yeah.
symptoms of hypoglycemia. Cold and clammy, need some candy. Remember, they're cold, they're clammy, they're shaky, they're jittery, they're tremory. Right.
Whoa.
What are some major signs and symptoms of Addison's disease? So we have what's happening with the blood pressure?
They
Low.
going up, right?
It's low.
It's low. Oh, it's the opposite
Yeah.
from Cushing.
It's the adrenal hypofunction. So think of hypofunction, adrenal, hypotension, hypotension, right? So you have low blood pressure with your adrenal hypofunction. Patient's going to feel weak, fatigued. They're going to crave salt, right?
Mhm.
They're going to have low temp. They're going to be hyponatremia, all those hypoglycemia, but hyperpotassium. So, okay, so those are signs and symptoms of Addison's. What are some signs and symptoms? We just talked about this a second ago of thyroid storm.
High BP, increased temperature, tachycardia.
Yeah. Think of a person who has hyperthyroidism. They're jittery, right? Their thyroid hormones are secreting a lot. So are they usually thin or heavy?
Thin.
Thin. Do they usually go to the bathroom more or do they get constipated?
They go to the
bathroom more.
They go to the bathroom more. Do they have a higher pulse or a lower pulse?
High.
Higher pulse. They're all jittery. Do they have insomnia or not?
Insomnia.
Insomnia. So they're thin. I'm sorry, what was I just? Oh, they're thin, but what's their appetite like?
They're hungry all the time.
They're hungry. They
eat a lot.
That's right. They eat a lot, but they're still thin. All right. What's a goiter? What gland is that associated with?
Thyroid.
Thyroid. It's enlargement of the thyroid, right? What are the cardinal signs and symptoms of diabetes?
The 3 polys.
3 polys: polydipsia, polyuria, polyphagia, right? They're thirsty because their blood's so thick with sugar, and they're urinating a lot to try to get rid of all that water, and then they're hungry, so they've got the 3 polys. We just asked this: signs and symptoms of hyperthyroidism. Oh, that was thyroid storm. Oh, I'm sorry. I was given signs and symptoms of hyperthyroidism, but thyroid storm, we have the high blood pressure, the high fever, very similar to hyperthyroidism, but more intense. Okay. What's exophthalmia? What's that a sign of?
And your eyes are bulging?
Yeah. And what's that? What disorder is that usually associated with?
Hyperthyroid.
Hyperthyroidism or Graves' disease, right? What hormone is responsible for diabetes insipidus?
Post pituitary.
Okay, so what hormone is that?
ADH.
Oh, ADH.
Is it high or low, ADH?
It's low.
It's low, right? And DI, dry inside, right? So are they urinating a lot, or are they retaining a lot of water?
They're
Retaining
urinating a lot, and they're always dehydrated. Low
Right. So the
and
DI,
hypernatremia.
right? DI, dry inside. They're urinating liters. They're dry inside. They're dehydrated. Their blood is thick. They have increased plasma osmolality. Remember, because they got rid of all their fluids, so their blood is kind of thick. All right. Signs and what can cause thyroid cancers?
Tumor of the thyroid.
What's that?
The tumor of the thyroid.
Yeah, but I was thinking more like radiation of the thyroid, low iodine, family history, so thyroid cancer. What are Schwastik sign and Trousseau sign used for?
to check for
Calcium
low
levels.
calcium and
Calcium
potassium.
level, low calcium levels, right? Low calcium levels. And how do you do a Schwastik sign?
The cheek.
Isn't that where you touch your cheek?
Yep. And what about Trousseau?
Pressure cuff.
Pressure.
Okay. All right. What's acromegaly? What's that have to do with?
Large.
Somatotrophin.
Somatotrophin, and it's from what gland?
Pituitary.
Pituitary, anterior pituitary, right? The somatotrophins, they get big features, right? Big hands, big jaw, big cranium. They look big, but they're weak, remember? And then their forehead bulges out. Everything is enlarged. What hormones, are responsible for calcium, and what gland are they associated with?
Thyroid.
PTH and calcitonin.
PTH and calcitonin, right? Someone said parathyroid. Which one is associated with parathyroid? The PTH or the calcitonin? PTH.
PTH.
And what's calcitonin associated with?
Lowering calcium in the blood.
And what gland?
Calcitonin. Oh, no, that's the calcium. Wait. See, that's how we get it wrong.
Yeah, that's why you have to think about it. But no, you're right. Calcitonin lowers the calcium in the blood, but what gland is responsible for calcitonin? Where's calcitonin coming from? Thyroid gland, right?
Oh,
T3, T4 calcitonin. Remember that? T3, T4 calcitonin. And then the parathyroid gland secretes PTH or parathyroid hormone, and which is going to increase the calcium level in the blood.
Right. Okay.
So these are things that can trip you up on the exam, because just because we go, wait a minute, was it high? Was it low? Was it, was it the hypofunction, hyperfunction? So just take your time. Don't rush through it, but keep an eye on your time. What are the trends and vital signs of someone with increased intracranial pressure? What happens?
Pressure widening.
Yes, widening pulse pressure, increasing blood pressure.
Increasing temperature.
Increasing temperature, and then the other two go down. What are the other two? Pulse.
Respiration.
Yes, and respirations, right. So your blood pressure goes up, your temperature goes up, you have a widening pulse pressure, and then your respirations and your pulse go down. Hang on a second. Lily, do you want to go out? Come on, let's go. Let's go. That's a good girl. My little blind dog. She can't see anything. It's like having an infant. Okay. What causes multiple sclerosis?
Isn't it autoimmune genetics? And they said unknown.
Demyelination.
Demyelinization. Remember the
Demyelination.
demyelinization? Right. But it is autoimmune and all that stuff. But it's the demyelinization of that axon. Remember those kind of big gaps in the axon where the impulse can't jump. That's what causes multiple sclerosis. What is the appropriate head position for a patient with ICP? When in doubt,
Semi-filers.
do semi-filers, right? Would we keep a patient's head with increased intracranial pressure neutral like this? Would we have it turned to the side? Would we have it, what would we do?
Midline, keep it straight.
Midline, right? You don't want, because doing this is going to increase pressure. Okay, so we keep that head neutral with patient with increased intracranial pressure. What's hemianopsia?
Isn't it like when it's half blind and you're supposed to scan the tray?
Yep. So you tell a patient, look to your left. Your daughter's been sitting there for 4 hours. When she says, my children haven't been visited, or, I don't have any coats. And you say, Mary, look at your left. You have 7 coats on the chair. So yes, that's hemianopsia, and it's half eye blindness. They don't scan one side of their field. So you have to remind them to look. Signs and symptoms of Parkinson. First, tell me the triad of Parkinson's.
Bradykinesia, muscle rigidness, and tremors.
Right. Bradykinesia, muscle rigidity, and tremors. And then what are some other signs of Parkinson's?
Shuffling gait.
Heel rolling, shuffling gait,
Micrographia.
What did you say? Someone else was talking.
Flat effect.
Flat face.
Flat affect. Yes, I'm having trouble. It sounds echoey or something. Flat affect, right. What's the medulla oblongata? Where's that located and what's the pons?
It's distal of the brains, and it's responsible for breathing, coughing, blood pressure, heartbeat, and the pons, it connects the medulla and the midbrain.
Right, exactly. It's part of the brain and it does all that. And the pons is simply the connector. TIA and a CBA, which one is short-term? Which one is long-term?
TIA is a baby stroke.
Yeah, it's right. So transient ischemic attack, right? Transient means you're not there long, right? When people talk about transient people living on the street, that means they're not living there long, right? So transient, same thing, it's temporary. So that's how you know the difference between TIA and a CBA. TIA is kind of temporary and a CBA is longer. Which type of stroke is 85% of the strokes? Is it ischemic or is it hemorrhagic?
Ischemic.
Ischemic, and hemorrhagic is the blood. It's about 15%. Hemorrhagic is a bleed in the brain, 15% of strokes, and the other ones are from a thrombus or an emboli, right? Know the different types of seizures. If I said my patient was convulsing and was unconscious, and which type of seizure would you think that would be?
Grand mal.
Grand mal or tonic-clonic, right? What part of the body causes seizures? What's happening? Why would someone have a seizure?
The brain ain't getting oxygen.
The brain is firing. It's just like, and the patient's they're just seizing, right? So the brain is firing too much. It's increased electrical activity in the brain, right? What does a nurse record for a patient with a seizure? Well, what would you record, John? If you saw a patient with a seizure, what would you record?
Time.
The duration, yep.
Probably location if you have to call 911.
Yeah, what they're doing. Are they conscious? Are they unconscious? Are they frothing at the mouth? The duration of the seizure, right? What position would you put the head in so you would protect their airway so they don't aspirate?
So it's turned to the side.
To the side.
Right. Yeah. What should a nurse do for the patient during a seizure? Well, the main thing we're going to do is keep them safe, right? That's why an ARA is sometimes, not that anybody wants a seizure disorder, but an ARA is actually not a bad thing to have during a seizure. Why is that?
Like the one let you know.
Because it kind of let you know. Yeah, it warns you. Maybe you go, oh, I have this feeling. I know that when I get this feeling, I have a seizure. So I'm going to go in my bedroom where there's carpet. I'm going to move the chairs out of the way. I'm going to call my sister or I'm going to call 911. I'm going to open the front door and I'm going to go lay on the floor. So you get ready. And as far as a nurse, we're going to do the same thing. We're going to protect the patient. We're going to observe the patient. Do we put anything in the patient's mouth to protect them from swallowing their tongue?
No.
No, he's not going to swallow his tongue. But you might get your finger bitten off because they're clamping down. We're going to turn their head to the side so they don't aspirate. Let's see what else. I can't think what else we would do for a seizure. Help me out, guys.
Don't you protect the head?
Protect the head. Thank you. Help them to the floor. Yeah, all those things.
Remove restrictive clothing.
Remove restrictive clothing. Thank you. Okay, so all of those things you would do. What's the period after a seizure called when the patient's kind of like just tired and maybe
post-ictal phase?
Post-ictal phase, right? What is status epilepticus? Who could tell me what that is?
When you have one seizure, don't come to consciousness and have another one.
Yeah, you don't regain consciousness. You seize, you stop for a second or two, and you seize again, you stop, but you never regain consciousness. Exactly. All right, you guys, you know all this stuff. How do you walk with a blind patient? Would you walk? Would you walk side by side? Would you walk in back? Would you walk in front? Which would you do?
A little in front.
With your arm on your shoulder.
Yes, you'd walk in front with the arm on the shoulder, right? So they could follow you. What is a Glasgow coma scale for?
Level of the
We're looking at comas, right? Is the patient in a coma? If the patient has a Glasgow score of 15, is that a bad sign?
That's a good sign.
That's a good sign.
That's a good sign. That's normal. That's what you and I have right now. What's the lowest possible Glasgow you can get?
3.
3. That means they got 1 and 1 and 1 point because we add them all up. What is the medical determination of a coma on the Glasgow score? What number?
8.
8. Right. When you get an 8, they need complete nursing care. They can't do anything for themselves. What are the 3 parts that are assessed in the Glasgow coma scale?
Neurological eyes.
Eyes. Anything else?
And the
Level of consciousness.
yeah.
Not level of
Hearing.
consciousness.
Don't you all after the commands open your eyes?
That's the eye. So we're looking at the eyes, right?
Hearing.
Is it motor response?
Yes, motor, eyes, motor, and one more.
Verbal?
Verbal. Eyes, motor, verbal. Okay, so those are the 3 things. Know that because that's a question. So the Glasgow coma scale determines a coma. 3 is the minimum. 8 is the definition of a coma. 15 is normal. You're going to check eye, motor, verbal in the Glasgow scale. All right. What's trigeminal neuralgia or tic de Leroux? And what should we do about it?
Isn't it a cranial nerve number 5 and avoid blast of heat and cold?
Yeah, and hot and cold drinks or hot and cold air. Right, exactly. Bell's palsy. What's this?
Like paralysis of the face.
Paralyzed.
Maybe bobbing.
Like a paralysis in the face.
Paralysis of the face, right? From a paralysis of a cranial nerve, right? What do we? What happens to the eye?
Oh, it'd be drooping.
Open. One side of the eyes open.
One side of the eye's open, it doesn't close, right? Because everything's paralyzed. You have Bell's palsy. There's a palsy, so you can't really blink. You can't protect your eye. So sometimes we have to put drops in the eye. Sometimes people will close their eye and put an eye patch on it. Things like that. What's the most important thing in caring for a patient with vertigo? What are we worried about?
Safety.
Yeah, absolutely. What should you teach a patient with glaucoma?
Wear glass. Wait, what they do at night?
Avoid driving at night.
Yeah.
Okay, avoid driving at night. They have, what are the 3 parts to glaucoma? There's 3, everything else was like
Intraocular pressure, nerve atrophy, and loss of peripheral vision.
right. And the intraocular pressure is doing what? Is it increasing or decreasing?
Increasing.
Increasing. So we have increasing intraocular pressure, optic nerve atrophy, and loss of peripheral vision, right? So remember the visions. It's a loss of peripheral vision. So if the patient said to you, I'm so excited to finish my glaucoma medication next month, what would you say? Would you say congratulations?
Continue doing it forever.
Forever, right? You got to continue it for life. So you're like, well, wait a minute, sweetie, you got it wrong. That's not true. Okay. What are some early symptoms of cataracts?
Blurred vision.
Blurred vision, fuzzy vision, hazy vision, right? Cloudy. What's clouding of the lens, right? We have that, remember that kind of white patch over the lens of the eye that you can see. After surgery, would we have the patient cough, turn, and deep breathe?
No.
No.
No, because we don't want to increase that intraocular pressure. So, okay, so you don't have the patient cough, turn, and deep breathe. What other surgeries would you tell a patient not to cough, turn, and deep breathe?
Anything above the neck.
Yeah. So brain, eyes, nose, throat, ears, and then what else? One other thing.
Fine.
Fine. Okay, good job. What instructions you give a patient who had, so patients going home, had cataract surgery. What are you going to tell them to do or not to do at home?
Don't bend at the waist.
Yeah.
No bend.
No Valsalva, no coughing, no lifting, no straining.
No straining, no coughing, no lifting, no bending, right.
Wouldn't we also tell them to keep the eye patch on until they go to bed
at night? Right. So they don't hit their eye. What patient should you discourage cough, turn, deep breathe? We just did this. Brain, eye, nose, throat, ear, spine. What's vertigo? What is vertigo? We just said safety is a big issue. What is it?
Dizziness.
Dizziness.
Imbalance.
So if you have vertigo, what's that? What is causing that? Is it any part of the eye? Is it any part of the ear? Is it
It's part of the ear,
a part of the ear? Which part of the ear actually?
inner.
Inner ear. Okay, so the vestibule, right? Remember the vestibule and the semicircular canals, they deal with balance, right? And equilibrium. And the external ear and the middle ear deal strictly with hearing. The internal ear deals with hearing and balance, and hearing being within the cochlea. All right. How can a nurse avoid atelectasis post-operatively?
Spots. You can tell them to use a spirometer.
In center spirometer, yes, absolutely. Cough, turn, and deep breathe.
Move around.
Yeah, move around. Get out of bed as soon as we can. I was going to say, why do we make a patient NPO?
To avoid aspiration.
To avoid aspiration, right? Okay. Know the types of anesthesia and their functions. Okay. Let's see. I don't know what's on the test. I can't remember. But if a patient is completely unconscious, which type of anesthesia is that?
General.
General anesthesia, right? We have to take full care of them. There's 4 parts of general anesthesia. What are those parts? More inducing, well, what are the parts?
Induction phase, maintenance,
Yep.
Emergence.
Duration and emergence, right? Emergence, we're waking them up. What are some, well, first of all, what is conscious sedation?
the patient is up, but they're not gonna remember. And the goal is that they have control over their airway.
Yes, conscious sedation is we're putting the patient under, they're having amnesia and analgesia, right? So they're not feeling anything, but they are maintaining their own airway and they listen to commands. So so they're breathing on their own, unlike the general anesthetic where they're intubated with a tube. A patient with conscious sedation is breathing. Mary, take a deep breath, turn on your left side, draw your knee up. Mary can do that. Okay.
Mhm.
All right. Okay. What's presbyopia?
Farsightedness.
Yeah.
Okay. In specific group of people.
An older age. And
Older age, right? If a patient came to you from the OR with a left stapedectomy, how would you lay them in the bed? Would you lay them on the stapedectomy side or on the other side?
Opposite side of the surgery.
That's right.
With the
The
ear
opposite
up.
side.
so the
That's right.
operative side would be up, right?
The operative side would be up because when you have a stapedectomy, we take out the stapes, we put a graft in. So we don't want you laying on that and moving it. So yeah. All right. What are cataracts? We just said this. What part of the eye is a cataract effect?
The lens.
The lens, right? Kiwi. Come on, girl. Look at
I
that.
don't know what be happening. I'm telling you. Yeah,
What
I ain't even done my study guide. I'm just
Good. You got it. You just have to believe in yourself, you guys. It's the end of the term. What nursing interventions will decrease the risk of venous stasis?
Hand stockings, walking, the CPM machine.
Yeah, just getting the main thing, getting them out of bed if they have an OOB order, right? If they're allowed out of bed, we get them out of bed. But other things, stockings, machines, moving their feet in the bed. If you suspected, so you tell me you suspect the patient has a DVT in the right lower leg. Why did you suspect that? What made you think the patient might have a DVT? Any signs and symptoms?
Yeah, they got heat in the leg.
Warm,
redness,
tenderness,
Pain.
and tenderness or pain and swelling. So warmth, redness, tenderness, and swelling. So you'd feel the back of the legs, the calves wouldn't feel the same, right? Would you massage that to make them feel better so he could feel better?
No.
All right, good job. If you had a patient, you came in and the patient said, I heard a pop or I felt a pop, and you looked and you saw an evisceration, what would you have seen? What's an evisceration?
maybe the insides coming out.
Yeah. So the wound opened, or you had a dehiscence, right? That means opening. And then in this case, our wound eviscerated, meaning the internal organs came out. What would you do?
Put a saline gauze on it.
Yeah.
In a hospital, sterile saline gauze. So it's moist, right? We didn't say dry sterile gauze. We said saline gauze. So it's moist. Because if you put a dry gauze on someone's intestines, what's going to happen?
It don't
To
stick.
dry it out.
It's going to stick.
Yeah.
It's going to stick. So we put a normal, we put a sterile saline gauze in the hospital. If it's at home, you probably don't have a sterile saline gauze. So you'd put a wet gauze on it. What should you not do if you think a patient has a DVT? We just talked about this. What would you not do to their legs?
Massage it.
Massage it. What's the purpose of an incentive spirometer? Can you remember any of those
You're
reasons?
gonna
To help
expand
the
the
breathing,
lungs.
help expand the lung.
Expand the lungs, increase oxygenation,
Prevent atelectasis. How do you say that?
prevent atelectasis. You're saying it exactly right. Expand the lungs, oxygenate the body. Okay. The main cause, what is the cause of anemia and thrombocytopenia? What is the cause of anemia? What's the cause of anemia and thrombocytopenia if a patient's on chemotherapy? What is being suppressed?
Immune system.
Their immune system and their bone marrow, right? So that's why patients get anemias, thrombocytopenias, leukopenias, their bone marrow is suppressed. What's a TNM staging system?
The tumor spread to the lymph nodes and metastasis.
Okay.
Tumors, lymph nodes, and metastasis, right? So if I said a TIS, what would that mean?
That's in situ, right?
In situ. We can get that out, right? Okay. And then, all right. How do you control severe pain? So how would you, if you had a patient, you were working on the cancer ward, oncology ward, and the patients all had cancer, how do you think we medicate them? At PRN as needed or what?
Around the clock.
24
Around
hours.
the clock. Around the clock, 24 hours. And then if they have breakthrough pain, we can medicate them for breakthrough pain as well. The first thing you assess any post-op patient,
Airway.
airway. But what if they just had a heart transplant? Wouldn't you want to assess the heart first? No.
Yeah.
You're going to
No.
assess the airway. You're going to assess the airway. Airways first. If the patient's not breathing, doesn't matter if that was a great heart, right? Doesn't matter if the surgery was beautiful. If the patient's not breathing, the patient's going to die. Okay. So first thing in the OR, don't let any question trick you, is the airway.
Yeah.
Who can tell me what a nosocomial infection is?
Isn't that a
Something-
medical facility?
Something got in a
infection?
hospital.
Yeah, it's a hospital acquired infection. Why do we send the patient to the operating room? We answered this. Why do we send the patient to operating room with an NPO status?
To make sure their stomach is empty.
Make sure the
Prevent
stomach is empty.
aspiration.
Why? To prevent
Prevent aspiration.
All right. What's stomatitis and what's that from?
Sores in the mouth.
Sores in the mouth. And it could be from HIV, could be from chemotherapy. What do you do about it? Would you give the guy steak and say, here, eat this high protein steak?
No.
Some raw broccoli, maybe? No.
Cooked vegetables.
We're going to give them soft foods, maybe smaller meals, a day, several a day, maybe lidocaine swish, right? Swish lidocaine and numbing cream in their mouth, soft toothbrush, or good oral care. Okay. What issues in a patient with internal radiation?
Don't you give them a private room?
Mhm.
No, change the sheets every day.
The healthcare professionals in there like 10 minutes, no visitors under 18, the bath from the waist up, and a 45-degree angle. And if it fall out, use that long handled spoon thing.
Yes,
Oh.
long handle forceps. Yes. You think the patient will be lonely?
Yeah.
I
Yes.
bet, yeah. So no people under 18, no pregnant women, 10-minute max visitation, sign on the door, private room, all those things. You know what they are. What about the sheets? Can you just take the sheets off and throw them in a regular hamper in the hallway?
No, you have to
No.
keep all their linens together.
Right, because they sweat and the radiation's coming out. Good job, guys. God, you had a great teacher. Dang. Okay.
Yeah. Yep.
I love you guys. What's leukopenia?
Low WBC.
Yeah.
Being able to fight infections.
Yeah, and we have to worry about infections. How do you establish the diagnosis of breast cancer? Okay. I don't know what this question is supposed to be, but if you felt a lump in your breast, and then what would you do next?
Call your clinician, and then they'll probably have you get a biopsy.
They'll probably have you go do a mammogram and then a biopsy, right? So you would, if you felt it, you call your clinician. Your clinician's going to do an exam. They may order a mammogram, and then they would biopsy it, right? Because the only way we can tell whether something's cancer or not is how?
Biopsy.
Biopsy. What does metastasis mean?
The cancer is spread to other parts of the body.
Cancer spread to other parts of the body. What would the patient avoid 24 hours prior to what would the patient avoid 24 hours prior to doing a pap smear?
Douching, vaginal cream, sexual intercourse.
Yep. Right. What's important to teach young girls about menstruations, peri-pads, and tampons? Okay. So this you guys haven't even had yet.
Well,
we have this.
That's what I put like if you have a heavy period, you shouldn't use tampons more than 4 hours, and it could cause that what is it?
Toxic shock syndrome, TSS. Yeah. That's exactly right. So we'll learn about this next week. So you can put a little star on the left side so you can remember to fill this in. But when someone has a heavy period, when they first start, they should wear pads, not tampons. Tampons and pads need to be changed every 4 hours to avoid toxic shock syndrome. Toxic shock syndrome is usually caused from a tampon that's been left in too long, and the toxins start to spread throughout the body and become get into the person's bloodstream. We'll talk about that next week.
To change every 24 hours?
Every
4 hours.
4 hours.
4 hours.
God, 24 hours. Yeah, no, not, yeah, 4 hours.
And you want to kill the patient.
You're trying to kill him. Man.
I try to stay away from that subject.
Is Candida albicans a bacteria, a fungus, a virus? What is it?
Fungus.
Fungus. What position should a patient having a pelvic exam be in? A lot of these are repeat. What position? Supine, dorsal, lithotomy, semiphallus. Lithotomy, that's right. Is postmenopausal bleeding okay?
Nope.
No.
Nope. Any postmenopausal bleeding is cancer until proven otherwise, right? Because 50% of patients with postmenopausal bleeding have endometrial cancer. Remember the lining of the uterus, the endometrial lining? If they have postmenopausal bleeding, that's cancer. We didn't talk about this yet either. We didn't talk about these difference between a lumpectomy and a radical mastectomy. We'll get into that. I'm not going to get into that today. But okay, so yeah, I don't really want to get much into this, but a lumpectomy with radiation gives you the same ultimate results as a mastectomy, not necessarily a radical, but a mastectomy. We'll talk about that next week. A lumpectomy with radiation and a modified radical mastectomy are the same ultimate outcomes. I'm not going to get in. Can PID cause problems? Do you even know what PID is?
Yes, it could make. Doesn't it make you sterile?
Yeah, it can make you sterile. Yeah. Let me see the rest of the questions. Yeah, we might have to do this after class on Monday and after class on Thursday, finish the rest, because these are all stuff you haven't even studied yet. So I don't want to, I can't really go over it with you because you don't know anything about it. Pap smear. Okay. Yeah, we can go over some of these after class. Let's see. Some of them we still can do. PID, the mastectomy, we're going to wait. Signs and symptoms of reproductive age changes in men.
Enlarged prostate, disrupt urine.
Yeah, the enlarged prostate, decreased sperm count, but not eliminated. Muscle mass a little bit smaller, that kind of stuff. Endometriosis we haven't talked about yet. What are we examining when we do? So when we're doing a pelvic exam, what are we examining?
The cervix, the uterus.
And the vagina, right. We can even sometimes, we do something with two hands. What exam is that called? Did we go over that?
We did go
Bimanual
over it, but I
exam.
forgot.
Okay, bimanual exam, 2 fingers in the uterus, 1 on top of the abdomen, and we're feeling inside by bimanual exam. What's cancer in situ?
100% curable.
Yeah, we're going to go in and we're going to take that piece out. ED and medications, we're going to get into that on Monday, and we can stay after class Monday just to go
Is
over.
that the endometrial?
No, that, wait, what? The ED?
Yeah.
Erectile dysfunction.
Oh, okay.
We haven't gotten into that. What's pap smear? What does it diagnose? What does pap smear diagnose?
Oh, we diagnosed cervical cancer.
Cervical cancer. Know the male and female reproductive system. I think we can't go over that right now, but you guys are having that quiz next week. So you already know the male and female reproductive system. What does tubal insufflation mean? What test is tubal insufflation? We blow air into the tubes. Like if you have a souffle, if you go to a nice restaurant and they bring you a
Is that
souffle.
the
Basically for the fallopian tubes.
For the fallopian tube. So we blow up the tubes so we can look at them. What diet may health care? Okay, PMS, we haven't gone over. Post-op instructions of a mastectomy, toxic shock. How do you explain menopause to your patients in the clinic? What do you tell them menopause is? If they said, what is menopause? What would you say?
Body's changing.
Ending your period.
Your body's changing, and one of the first things is, that's right, is changing your period. That's one of the first things that happen.
Also, but you have a decreased estrogen, and maybe they should start taking a calcium supplement because you increase risk of osteoporosis.
Yes, ma'am. That's exactly right.
Good notes.
Hysterectomies, we're going to talk about amenorrhea, epididymitis. These are all, can you be asymptomatic? Can you be asymptomatic with an STI and be infectious?
Yes.
Absolutely.
A carrier, nasty.
What do genital herpes look like?
Oh,
They're like, go ahead.
I was going to say that's like fluid-filled vessels that they erupt and they become like painful ulcers.
Yeah, I feel like you have my notes.
Yeah, she got all of our notes.
Yeah. So it's a fluid-filled vesicle, and that it erupts, and then you have like this open ulcer. And it's very painful. Chlamydia, we're going to talk about dangers associated with HPV. What's one of the things that we know about HPV?
That it can turn into cancer if it's untreated.
That's right. It can increase your risk of cervical cancer. Early signs of HIV infection.
Night sweats.
Flu-like symptoms.
Night sweats, weight loss, diarrhea, fever, right? All of those things. Flu-like symptoms, yes. Can an asymptomatic patient with HIV be infectious?
Yes.
Absolutely. What system does HIV attack? Pulmonary?
Immune
system.
What are universal precautions?
Gloves.
Gloves, mask, face shield.
Yeah, it's protecting us against bloodborne pathogens. Okay. What opportunistic infections are associated with HIV?
The Kaposi and pneumocystic pneumonia.
Kaposi sarcoma, and which one?
Kaposi sarcoma, pneumocystic pneumonia, and thrush.
And thrush, right. So those are 3 types of opportunistic infections. Opportunistic infections means the patient's body's weak and the HIV goes, I'm taking this opportunity to destroy you. That's an opportunistic infection. Chemotherapy works by how?
Stop
all the cells in the body.
Disrupt the cell patterns.
Yeah, it disrupts it. It disrupts the replication patterns of the cell, right? So it doesn't let it replicate like it wants to. Okay, guys, I feel like we got over everything except like next week's lecture. ED, hysterectomies, cancer of the breast, mastectomies. So what we'll do is we'll have the lecture, And then at the end of the day, if you want to stay for probably 20 minutes, that's all we need. I think there were probably less than 10 questions. We can stay and go over that for the exam. Does that sound like a deal?
Yes.
All
Yeah.
right, guys. All right, listen, have a great weekend. Study hard. I want to see all 90s on that quiz Monday because you can do it.